Dr. Lafontaine, thanks for being with us, and congrats on your new role. Can you tell us a bit about that role and the association you'll be representing?
Yeah, absolutely. So I've recently been confirmed as the Canadian Medical Association President-elect. So the President-elect is one of 3 years that the leaders of the CMA have in impacting healthcare change and advocacy across Canada. I'll become CMA president in August of 2022 and then past president the following year.
You've talked about, and we hear a lot about, systemic racism in the healthcare system in the past. What are some of the barriers as you see them, and how do you think you might be able to address them in your new role?
So I think one of the great things that happens whenever someone from an excluded or disempowered group becomes a part of decision-making tables is that they can bring a new perspective and new insights into those decision-making tables. It's one thing to listen and understand, it's another thing to live and understand. And what I'm hoping to do is bring my experience as an Indigenous person, someone who is Métis with Korean Anishinaabe ancestry, as well as Pacific Islander from my mom's side, and bring that experience of what it feels like to be disempowered and experience those racialized, instances in the healthcare system into the work that we do at the CMA. One of the things that I've realized going through, racialization on both sides as a patient and as a provider is that the shared experience of disempowerment, having someone take ideas about who you are and what you represent and what you're about and kind of projecting that onto you is something that all patients experience, but Indigenous patients in particular experience at a much more magnified sort of way.
We recently had Mary Ellen Turpella-Fawn's big report that took place in British Columbia, and I think we could apply that to nearly any province and territory in this country. How big of an issue should systemic racism in healthcare be in this coming election?
So I think one of the things to recognize when it comes to racialization in healthcare is that it exists everywhere, but it's not necessarily a big enough problem in all places that people access care. One of the things that we really learned from the Insight report and from reports that have been, published and shared for many years is that the lived experience of racism is real and it has direct impacts on patient care. I'm excited that the federal government has indicated a willingness to address this issue. I hope regardless of which political party ends up moving into the office and running the government after this election, that they continue with that commitment. And I believe that it'll have enormous impact on Indigenous patients.
Well, Dr. Lafontaine, we'll have to leave it there, but again, congrats and good luck going forward with the new role.
All right, thanks for having me.